There are 9 new community cases to report today, all in the Auckland region. That takes our total numbers associated with this outbreak to 1,131. Of those, 902 cases have now recovered. Additionally, there is 1 new case in a recent returnee in our managed isolation facility. Of today's 9 new community cases, all are linked. 3 are household contacts and 6 are contacts of known cases. For yesterday's 15 cases, only 1 remains unlinked, and investigations into the case are underway to determine if there are any connections. There are 13 people in hospital, with 3 of those in ICU. Testing numbers in Auckland dropped a little yesterday, but 6,928 swabs were still taken across Auckland, with 14,855 swabs processed across the country. At our new suburb of interest, Mount Wellington, there were 297 swabs taken yesterday. That's a great effort, so thanks to everyone who came forward to be tested. In Clover Park, which has been a suburb of interest this week, 1,725 swabs have been taken since Tuesday. Since the 1st of September, 20.8% of that suburb's population have been tested, which is a great effort, but we still want people to come forward for testing in that suburb. As Dr. Bloomfield mentioned yesterday, there is a new testing requirement for people who need to travel across the alert level boundary for personal reasons. That requirement is for most people permitted to travel for personal reasons from the alert level 3 boundary into an alert level 2 area, for example, travelling from Auckland to Hamilton. These people now need to carry evidence of a negative test result taken 72 hours prior to their travel, or proof a test was taken within 7 days prior to their travel. There are 2 exceptions to this testing requirement. No test is required for the following: for one-way travel for people travelling from an alert level 2 into alert level 3 and then remaining there, and for people attending a healthcare appointment, including vaccinations, who are travelling from their residence in alert level 2 into alert level 3 and then back into alert level 2. They do need to have evidence of their appointment and be able to show that if requested. Details of the testing requirements can be found on the Unite Against COVID website. Just a reminder, it can take 24 to 48 hours to get results of your test, sometimes longer depending on the demand for testing, so please plan ahead and factor that into the time for your travel. All tests in upper hierarchy have now come back negative, with the exception of members of the Whakatiwai household, which have already been announced. I can also report there's been a good uptake of vaccinations in the Hauraki Plains, with 60.1% of residents there now having had their first dose and 23.9% their second. And just turning to our vaccine rollout, there have been more than 4.91 million doses given. Of those, more than 3.19 million were first doses, covering 76% of the eligible population, and more than 1.72 million, or 41% of the eligible population. That's the population aged over 12 and over. Yesterday, more than 49,115 doses were administered. That's broken down into 20,983 first doses and 28,132 second doses. So those second dose numbers are coming up. In Auckland yesterday, there were 16,258 vaccines given. Overall in Auckland, more than 1.7 million doses have been administered. Of those, 1.16 million were first doses, covering 81% of the Auckland population, and 626,103 second doses, covering 44% of the population.
Ministers have today agreed that the Upper Hauraki will move down to alert level 2 at 11:59 p.m. on Saturday. As Dr. McElnay has indicated, we've had an incredible response from the Upper Hauraki community, with people getting tested, following the health advice and sticking to the alert level requirements. More than 1,000 tests have been undertaken in the immediate area since Monday, with the only positive results, as you've heard, being from the original household. All the close contacts from the Mangatangi school exposure event, including staff and students, have been tested, with all tests returning negative. Today's case numbers are encouraging, and they indicate that the hard work of Aucklanders in particular is paying off. But as you have heard us say before, the job is not yet done. As we head into this weekend, I once again ask for people in Auckland to remember that it is still alert level 3. We need you to stick to your bubble and to stick to the rules. 76% of the eligible population now have a first dose. Today, I want to particularly mihi to our Māori health providers for coming up with innovative ways to bring whānau forward to get vaccinated so that they are protected against the virus. For example, this Saturday in the Waikato Rohi, there is a mass vax event from 10 a.m. to 3 p.m. to deliver vaccinations. And can I encourage whānau across the Waikato to go to the Hopu Hopu Sports Ground in Ngarewa to get vaccinated? I do hear that there are prizes on offer, including a trip to Rarotonga. You just need to show up. No booking is necessary. With the move of Auckland into alert level 3 this week, we estimate about 280,000 more people will have been able to go back to work. And I'd just like to remind everyone of the rules for businesses at alert level 3. Firstly, staff should continue to work from home if they can. If your business requires close physical contact, it cannot operate under alert level 3. Your business must be contactless with the public. Your customers can pay online, over the phone, or in a contactless way. Delivery or pickup must also be contactless. Staff should remain at least 1 metre apart and 2 metres away from any other person. In terms of travel, as the Prime Minister indicated on Monday, permitted movement across the alert level 3 and 2 boundary is essentially the same as it was when Auckland was at alert level 4. This is because we are dealing with the Delta variant, which, as we know, is far more transmissible. The strong advice from our public health officials is that we do need to continue to take a precautionary approach. In the case of businesses, you need the business travel document and you need to be tested. You need to be part of the testing regime. Key movement like freight and primary industries is allowed to ensure food and other supplies can move. There is an obligation on employers to have systems and processes in place to minimise travel of workers between alert level areas and mitigate the risks of spreading COVID when workers are travelling. If you're not sure of the rules, please do go to the Unite Against COVID-19 website to check them. Having said all of this, we recognise that the longer the restrictions are in place, the more challenging it is for people to meet deadlines, such as the settlement of house sales or starting jobs outside the region. Equally, those who have been in Auckland undertaking carer duties may have completed these, but they are currently unable to leave. There is an exemptions regime for both personal and business travel that is ultimately managed by the Director-General of Health. We have agreed that ministers will work with the Ministry of Health to look at the exemptions regime to facilitate some more one-way movement to relocate out of Auckland. We anticipate that this will include testing requirements. Ministers will consider this advice on Monday, and we will announce any changes as soon as possible, given the pressure that we know some people are under. Just before we go to questions, for those watching at home, this is to let you know that there will be no 1 p.m. media conferences on Saturday or Sunday, just the statement from the Ministry of Health with the latest case numbers.